I talk about lip lifts all the time in my practice. I did one 2 weeks ago. So I am not opposed to doing lip lifts, but I do them very cautiously. When patients want to come in and talk to me about a lip lift, oftentimes they are surprised to hear that I don't want to talk about that first. I want to talk about their dentist, their orthodontist, their underlying dental and facial structure underneath their lip. Lips are a structure. They're a tube. They've got mucosa or skin covering, and they've got fat, and they've got muscle. There's not a lot of shape to a lip. Actually, intrinsically, the lip gets its shape and a Cupid's bow, and everything that we identify with youth and beauty generally comes from underneath. So then we got to talk about the dental line first. Lip procedures started getting very, very popular in the non-invasive world with the advent of Botox, particularly for people who had a gummy smile. And gummy smile most commonly is a representation of a very fancy term I shouldn't say because I'm not an orthodontic surgeon, but it's vertical maxillary excess, or actually the shape of the upper jawbone of the maxilla and how it relates to the lip. But Botox allows for softening of the muscles to cover a little bit of that. It's an okay trade, but it's natural in the progression of learning how to deploy a medicine in more of a surgical situation to see what other limits can kind of be pushed, including, as we learned to treat lip lines with Botox, we learned, well, in some patient, the lip actually flips up. Well, that's kind of neat. Patients learn about the lip lift. It's a very exciting procedure, but oftentimes it doesn't apply to their anatomy, and it requires really careful analysis and consultation to help them avoid a procedure that they're not going to enjoy. Surgical lip lifting is a particularly useful procedure when the skin is in excess from the base of the nose to the top of the lip. And that's really the best situation. I have seen unfortunate results of young patients who don't demonstrate that excess and that they are seeking a more prominent Cupid's bow. There are much safer ways and reversible ways of accomplishing that without committing to a skin removal procedure that is permanently going to change the shape of their lips at best, and at worst, make it so that the patient actually can't close their lips or maintain oral competency.